I work in an area where we had a tremendous tragedy 3 years ago in North Kensington. We had a big fire. It was a situation which felt very much like the pandemic. So we've been through this twice, let's say, and other people would have been through other events. And I think what we learned from that, how we came together, was we all had the same focus and the same desire to not let that happen again, and to use the strength in our community to rebuild. And I think it's the same with this pandemic. In fact, we had to grow our own leadership, grow from the ground, lead from the ground, and then share that around with others so everyone else could benefit from the underground leadership within the system and make the changes happen that we want to happen, rather than waiting to be told. And I think that that approach, we are keeping it. We're not going to lose it. We've all valued it. We've reflected and discussed it with our secondary care teams as well. I think primary care has the advantage. We are ultimately in charge of our own budgets. We're in charge of our own businesses and our own teams, and we call the shots. And I think we have to remember that we are able, if another crisis happens or the situation arises, we are able to mobilise, come together and make change happen. The other beautiful thing about primary care, we have to remember, it's up to us how we design and structure our teams. We can also put the red tape in there. We can put the board meetings, or we can have the hierarchy, and we have to go through many hoops. And we know we see it quite commonly, some practice nurses can sometimes struggle to implement change in their practice because they've got to go to the senior partner in the system and convince that person to make change. And I think that's something we should reflect on in the pandemic, that we felt that as GPs before the pandemic. We felt we had to go to lots of formal meetings to make any change happen. And then when we were given permission, we got a tremendous result for our patients. So I think it's remembering that in our teams as well. So removing the hierarchy, keeping it as flat as possible, keeping your team close to you, and also finding the strengths from within ourselves. I never thought, I feel quite awkward being on here talking about being a leader. I wouldn't think of myself as a leader, but clearly the kind of asked me to speak, so there must be something in here that's needing to be shared. So I think the leadership from within, finding everyone has the capacity to lead. That's one of the roles of primary care. It's not just clinical work. It's obviously we see the gaps in the system, and we see when you see a crack in the system, you can't just walk past it, especially when you're a position of authority and a position of power, which a GP ultimately has in the system, and that's something we need to remember to empower our teams with as well. So to bring them into the role of leadership. And definitely when I'm thinking about leadership, I don't think about myself at all. The picture I'm seeing is the collective, it's the structure, it's everyone coming together and combining. And it's not just primary care. I'm seeing secondary care, I'm seeing the community right in the centre, in the forefront, and of course the government, and they're there to support us, and the local council. But it's that integration, and it's that bit in the middle, it's bridging that gap that we have the ability to do through our knowledge of our patients and their needs and of the system. And I think that probably is that's the beauty of primary care. Yeah, the ability to shape and influence and create and grow and design in primary care is that interface, and that's where leaders need to sit.